With Congressman Mike Pence, Republican from Indiana. Congressman, good to have you on the program. Thank you very much for joining us. We've got Doug Holtz-Aiken here with me in the studio. Right. Let me first get your reaction to the health care bill that the House Democrats unveiled early this afternoon.
Well, it just seems like, once again, House Democrats are out of touch with the economic woes of millions of Americans. Look, this economy is struggling. American families are hurting. It's clear now, nearly 6 months on, that the stimulus bill passed this February is not working. And now, immediately in the wake of having passed a massive national energy tax in the form of cap and trade, now today we have unveiled a laundry list of new tax increases. Doug was talking about this: taxes on jobs, taxes on individuals who can't afford health insurance, taxes on small business owners. You know, they talk about just a surcharge on people making over a certain amount of money. Well, most statistics show that most Americans that file at that upper income level, at least half Americans who file at that level, are small business owners filing as individuals. You know, the last thing we should do in the worst recession in the last 25 years is raise taxes on small business owners in this country.
So
we can do health care reform without raising taxes and funding a government takeover of health care.
What's the alternative, Congressman? Give us your ideas, because obviously this is an expensive package. The money's got to come from somewhere.
Yeah.
What's your idea?
Well, I think the first idea is let's reject the idea of a government-run insurance option as a means of having the government compete with the private sector. You know, the federal government competes with private businesses the way an alligator competes with a duck. It consumes it, and most people know that. You have a government option, tens of millions of Americans would lose their health insurance, and millions of Americans would very likely lose their jobs as businesses faced additional costs. Move away from that idea. Move toward, and I think I heard a glimmer of this in Doug's comments, move toward real reform. Republicans have long supported ideas like medical savings accounts on an expanded basis, association health plans that would allow people to create nationwide risk pools for certain types of employees. And for heaven's sakes, let's also recognize the extraordinary cost of medical malpractice liability in our current health care economy. I met with doctors in Indiana this weekend who talked to me about essentially the defensive medicine actually being an extraordinary increase in cost. We should do health care reform. We should take more than 2 weeks to do it, which the administration and the Democrats in Congress want to do. But first and foremost, for heaven's sakes, Maria, let's not raise taxes on working Americans in the worst recession in 25 years to fund a government takeover of health care.
Maria, I think there are two important points here. First is the surtax that they want to use to, quote, finance this doubles if it turns out to be more expensive than they thought. It will most assuredly be more expensive because there's nothing in there to slow the growth of costs, so we're going to have big tax increases. A better way to go at this is really go out there and do the tort reform, do the kinds of delivery system reforms and payment reforms, so there's a business model for health information technology, so there's a reason to create value in the form of preventive medicine, all the kinds of things that will stop costs from growing so fast, and then shift the focus to the states. We've seen real attempts at health care reform in Massachusetts, very blue state, not my favorite, but they did it. Utah, very red state. Across the United States, we could let the states take the lead, and as the costs come down, expand coverage through their efforts. That would be a sensible reform.
Congressman, you heard what Doug Aiken is saying. You know, you hit on an interesting point as well, as far as this 2-week period, rushing this through. You know, House Speaker Nancy Pelosi expects a vote on the bill before August recess begins. President Obama said it in no uncertain terms: we're going to get this done. Is it realistic to get this done by the time Congress goes on vacation in August?
Well, look, I've seen the heavy-handed tactics of the Democratic leadership in the White House here on Capitol Hill are unprecedented in my nearly 9 years of service in Washington. So can they get it done? Can they twist enough arms to get it done? You know, I'll leave that to the pundits on your show. But should we get it done? Should we take all of 2 weeks to bring about a massive transformation of the role of the federal government in our healthcare economy, nearly 1/5 of our economy? I think most Americans would say no. And also, Maria, I got to tell you, I was back in Indiana this weekend. People are concerned about the economy, jobs, the deficit. They want to see health care reform. They want to see us have a strategy for energy independence. But they want us to take time to get those things right. But job one right now ought to be creating jobs in this country. And all we're hearing from the White House, the president said recently, is the stimulus bill had, quote, done its job. And we're hearing the same thing from leaders in Congress.
Actually, on the stimulus bill, do you think we need a second stimulus package, Doug?
No. The first stimulus was badly flawed, and given the budget outlook, the last thing we need is another stimulus bill. We could cancel some of the first stimulus bill and very effectively cut some taxes. That would be the best strategy in that case.
Yeah, Republicans know what we really need for a real recovery is fiscal discipline in Washington, D.C. that'll give markets more confidence that there's some restraint in the nation's capital, and then combine that with immediate tax relief for small business owners, family farmers, and working families. We can do that by rescinding the current stimulus bill. But for heaven's sakes, don't roll out this long new laundry list of tax increases on individuals and small businesses. You talk about going from the frying pan into the fire.
Yeah.
You know, we pass this health care reform, and we might see our economy take a nosedive.
Congressman, I know you've got to go. You've got to vote, so we're going to let you go. But I've got one final question before you step away from the camera, and that is, what is so expensive as far as health care is concerned? Can you educate us on exactly why it is that health care costs keep soaring every year?
Well, I'll tell you, I really do believe that it's the lack of a competitive business model for particularly small business owners. I've literally had small business owners in tears with me in the past, seeing 30, 40, and 50% increases in their premiums, and it's simply because you don't have the ability to pool employees on a national basis. Insurance is governed on a state-by-state basis. That's kind of reform Doug is talking about. It's called association health plans. Your viewers can check all of this out at gop.gov. There is reform we can do. We don't need a government takeover, government-run insurance, more taxes. There are better options.
All right. Congressman Pence, good to have you on the program. Thanks very much.
Thank you, Marie.
We appreciate it. We'll see you soon. Congressman Mike Pence, Republican from Indiana.